This is the Healthcare Podcast, your B2B show for the best thought leadership in the industry, bringing you information, education, and inspiration, only on Market Scale.
No industry, including sick care, can be fixed from inside.
For every 1 hour that they spend on patient care, they're spending up to 2 hours on EHR data entry.
Well, welcome to the podcast today, everybody. I'm your host today, Tyler Kern, and joining me on the line is Dr. Anthony Harris. He's the VP over Onsite Clinical Operations. He's the Associate Medical Director at WorkCare, Inc., and he's the founder of Bio-Ergo. Dr. Anthony Harris, thank you so much for joining me here on the podcast today, sir.
Hey, thank you. Appreciate to be here.
Absolutely. You have a lot of titles, so yeah, you're an important guy. It's fun to get to talk to people like you that are just so involved in lots of different areas. But today we're talking about preventing and managing injuries sustained in the workplace. And I want to just start off by setting up the problem that's taking place across the country, if we can, Dr. Harris. Just what's the issue that's taking place in workplaces around the country, and what are some steps that we can take to solve it? So let's start off just by setting up the problem. What's going on across workplaces?
Sure. So the problem has been articulated and elevated over the last several years, in particular by the National Safety Council. So in 2016, National Safety Council published a lot of data and reports on the number one type of workplace injury, and it was cumulative trauma or overuse or overexertion injuries. And particularly what overexertion injuries are those back injuries and shoulder injuries that happen over time. And so the trend over time has been is that these injuries have bubbled to the top because the industries and various industries have done a pretty decent job of addressing some of the other types of injuries in the workplace, like the fire hazards, the slip, trips, and falls, and other safety preventative measures that have been deployed. But there hasn't been over time any really good tools to address the cumulative trauma or overexertion injuries in the workplace. And so if we look at the data on the number of injuries and the cost of those injuries in the workplace, we're dealing with big numbers here. If you look at the cost associated with a back injury, it can be as high as $80,000, and that's the average. And if you look at total sum of the direct costs of these type of injuries in the workplace, we're talking $15 to $20 billion in direct medical costs alone, and that number triples up to $50 to $60 billion in some reports, including the National Safety Council, and so that's an annualized cost to businesses, to the medical communities as well. And certainly, and most importantly, that's a cost to the individuals, to the workers who are suffering these injuries that could be 100% preventable.
Absolutely. So we're talking about painful injuries, but also then costly injuries. And that's obviously something that is concerning both to those individuals, like you mentioned, and then also to the businesses that employ them. So what advancements and what technology has been, what advancements have taken place that have allowed us to maybe know a little bit more about these injuries and maybe collect some data on those? What advancements have been made in this field over the last several years?
Sure. So if we can take a quick trip back, let's say 30 years ago, the state of the art 30 years ago with regard to addressing these type of overexertion injuries was a way of looking at ergonomics. So ergonomics is the study of human-machine interface, essentially. And 30 years ago, we came out with the science came out with REBA, rapid entire body assessments, RULA, rapid upper limb assessments, and some of the biggest improvements have been Schnook tables, which came actually in the 60s from two founders with Liberty Mutual. And those tables helped employers and environmental health and safety professionals really understand and start to put to number some of the impacts that various jobs are having on workers. And so we would look at body angles, we would look at how heavy the materials were being handled, and then the distances and the whole nine of analyzing the impact of moving these materials, interfacing with machines to the human physiology. One methodology I would be remiss to mention is the NIOSH lifting equation. So, there were both public as well as private entities trying to get after the problem to better understand the impact of these type of exposures in the workplace. And as we fast forward from the mid to late 60s up until the 90s and then till today, we still have been using these classic tools and still are used ubiquitously across the table to try to understand these type of injuries and impact to the human physiology. So as we leap forward now to what's coming and what's here and what we're doing in WorkCare is we're deploying wearable technology. And the technology was born actually back in the late 70s only in the clinical setting. It was in the clinical setting that we were able to apply a technology called surface electromyography. If anyone has ever recalled the $1 Million Man running on the treadmill and has a bunch of leads and wires hooked to his body.
Sure.
Yeah, so that picture is exactly what we're talking about, where they were looking at his muscle activity while he was exercising to understand how do we make this individual better, faster, right, more nimble. And so in the same way, your doctor, when you go for a visit and get an EKG, will put several leads on your chest to look at the activity of your heart muscle and look at how hard it's working to determine the impact from a risk standpoint of that exertion on your heart. We do the same thing with regard to looking at other muscles that are important for determining risk factors for shoulder injury, back injury, knee, groin, and the whole nine. And so it's a holistic way of looking at these type of injury exposures. And in short, we don't have to measure some of the classic metrics any longer, such as body angles and push-pull forces and whatnot, because those are all proxies for what's actually happening to the human body. And we're now able to directly look at, using this technology, the responsiveness of the human body and the actual muscle exertion while workers are doing their normal job. And so it's been a really cool opportunity for us to deliver objective data to employers, to health and safety professionals in the shadow of the classic approaches that have still incorporated to a large extent subjective inputs to try to determine and quantify these level of risks in the workplace.
Absolutely. So are employers able to get back data that would give them insight, like this is the amount of strain that's put on the body for this particular task, so then they're able to more effectively and efficiently monitor their employees for the amount of strain that they are putting on their body, so they can then maybe manage that workload better? Is that something that you would see as maybe an outcome from this?
Absolutely. That's a direct outcome. And when we talk about quantifying the exertion or demand that's put on the body so that you can mitigate risk downstream, we're talking about a concept of primary prevention. Okay. So I'm board certified in occupational and environmental medicine, and we fall under a preventative medicine umbrella in our specialty. And classically in medicine, we've, as physicians and clinicians, we've done tertiary prevention quite well, right? And tertiary prevention, for example, is you come in with a cut to your finger and we'll assess and stitch it up so that you don't get a finger infection and potentially have long-term disability as a result of, an injury, permanent injury to that finger from the infection. The secondary prevention, kind of next box, if you would, of prevention is if you're in the workplace and you're starting to have some shoulder pain as a result of doing a particular task over and over, then that moment of intervention we call secondary prevention, because you may not yet have an actual injury, but we can intervene when you have symptoms to prevent that injury from happening, right? And so what we're talking about now as we deploy wearable technology is in the what we consider the green zone, right? If each box is a different color, the primary prevention is the green zone. Workers are healthy, don't have any symptoms necessarily, and they're doing their job just fine. The yellow zone, secondary prevention, it means that they're having symptoms, and obviously tertiary prevention is the red zone where you have an injury. So as a practice in preventative medicine, we're in our group is pushing the boundaries towards primary prevention and delivering metrics for employers to understand and mitigate risk before their workers start to experience any symptoms at all. And that's the kind of holy grail of where we as a practice want to live, because again, an ounce of prevention is worth a pound of cure. So we have been successful in delivering those objective metrics to the employers so that they can directly then intervene. One good example of that intervention is job rotation. So right now, if you're in the workplace and you're doing a particular job over and over, then that repetitive nature of the job is impacting perhaps, let's say, your right shoulder or your left shoulder over and over. And so now we can quantify directly the impact of that job on the shoulder and determine an actual dose limit for that particular job, meaning that these workers experience fatigue after doing this particular job for 4 hours. And so now employers can then take that data and it's actionable. So tomorrow they can actually change their work schedule to rotate the workers from that job at 4 hours to another job that we've already determined is lower risk for shoulder, for example. And it's that dynamic that has not been possible previously because of the subjectivity of the assessments, and having the objective, consistent, repeatable data is what is pushing us forward.
So this would obviously require, because you want the data to be objective, and you want to have a lot of data to ensure that I'm guessing that to ensure that your findings are consistent across the board, right? So you have to have a vast collection of data, I would assume, over a lot of different industries. Is that right?
Yeah, so as we move forward in collecting more and more data, I mean, we are talking about big data, right? This is certainly in the realm of IoT, Internet of Things, and the data points that we collect are vast. For example, with 8 workers in the course of one session or one day, within a couple hours, we generate over 1 million data points. And each of those data points are important in determining what those workers are experiencing for that particular job. And it's with that level of data that we're able to then draw patterns and use our clinical algorithms that we've constructed from evidence-based medicine several years ago to help employers understand the risk factors that exist in the workplace. And when we talk about forward-looking of additional value-added analysis, opportunities that we've doubled down on in terms of partnering with a Google in one of the programs here in Chicago to help us do some machine learning around the data that we're collecting, so that now, whereas me as a clinician would not be able to look at those vast amounts of data and try to see patterns that help predict risk, we can teach a machine to do that analysis and to help us really be even more prospective in our prognostication of risk for these type of injuries.
Sure, absolutely. So as we're talking about this, the question just kind of came to mind. For somebody like me who thinks of wearable technology just as a Fitbit or something like that, what do these wearables look like, and how can they, function in the workplace?
Sure. So there are all sorts of types of wearables, as you're suggesting. There's smart glasses, smart watches, smartphones. There's smart clothing, and smart clothing is what we're talking about. If you look at the trend of smart clothing, particularly in the U.S., the compound annual growth of units of delivery, the units delivered of wearable technology, and particularly smart clothing, is roughly 22%. compound annual growth. And the number of units are going to climb upwards towards 20 million by 2022, according to some reports. And that's a trend that certainly is showing us that the market and individuals in the U.S. are really ready for wearable technology and accepting wearable technology. In particular, in the workplace, there's a Kronos survey that was conducted in 2016, and that survey looked at adult workers, 18 or older, and asked the question, do you believe that wearable technology could be used in a workplace setting for the benefit of individuals as well as the business? And overwhelmingly, the response globally was in the high 90s. China, I believe, was 94%. Mexico was in 96%. But unfortunately, the U.S. was a little lagging behind. We were only about 46%, I recall, in that survey. And so that just suggests that we have some work to do, one, as an industry of environmental health and safety, and two, as clinicians, to really deliver tools that can be useful and actionable in terms of the data it produces. We talk about actionable data, right? One of the opportunities I had recently was to sit down with Mayor Pete Buttigieg, who's the mayor of South Bend, Indiana, and now running for president, probably the youngest to ever run for a U.S. president now. And when we met with him to try to understand how we can partner to use and deploy wearable technology to keep his firefighters and police officers safe, very, very brilliant guy. And within the first 5 minutes said, hey, look, I get it. You guys are wearable technology. You produce a lot of data, and often when we encounter in the past technology companies like yourself, you tend to plop a lot of data down in our lap and then kind of walk away, and we have no idea what to do with it. And that is certainly his experience is not isolated, right? And we've seen that over time that if you are not delivering with these IoT and wearable technology solutions, actionable data, things that employers and customers can take immediately and implement change, then you're not really providing a tool that is substantial in regards to making the impact that you're seeking to change. And so we've been delivered. We've been deliberate. Amen. Right? We've been deliberate in how we've addressed transforming these vast amounts of data into nuggets that employers can then take and make both clinical and health and safety decisions, but also business decisions, right? And so when I talk about the business decisions, I'm putting my M.B.A. hat on, and we start talking about and engaging in productivity analysis. Mm-hmm. So as we break down our process for employers, we break down the job level type of activities in the workplace down to tasks. And then when we talk about productivity, we break those tasks down a step more granular into subtasks. And this science has been around since the 60s as well. H.B. Maynard was the pioneer of this approach. It's called the standard labor, where a normal worker under normal levels of exertion should be able to do a particular job and task within a certain amount of time. And you can go and directly measure that on the shop floor, for instance. And the activities and tasks and subtasks involve literally a reach and a turn and a grasp, and then a lift, and then setting something down. Each of those activities are considered, we consider subtasks. And so we can, in our process, by default, time those tasks, have a visual representation, and then also, have a exertional representation of those different tasks and how it's affecting that individual and how it's contributing globally to the overall risk for the various types of injuries we look at. And so when we talk about productivity in the context of exertion, there's clear literature associating overexertion with decreased productivity. So as we quantify the level of exertion that workers are experiencing in these particular jobs, we've had a lot of success with, for instance, warehouse workers and these large distribution companies, to understand how can they increase productivity of their pickers by decreasing the exertion that they're experiencing with different tasks. So there's so many different use cases for this type of data as we talk about, the largest and the most, valuable asset in the workplace is the people. And so what we do is understand how can we more effectively keep people safe and also boost their productivity through decreasing overexertion.
Absolutely, and it sounds like with that level of granularity that you're able to get to, that you're able to then tailor the data and tailor your approach to the specific job. So if it's a job that maybe requires people to be on their feet the entire time, maybe you take a look at something different. Is that something that you're able to do to kind of, I suppose, personalize the approach to a certain extent to understand what exertion each job requires?
Sure. So we actually, certainly we can tailor, per se, our approach, but how we tailor the approach is not from a measuring standpoint, because when we do measure workers, we're actually measuring the entire body, upper extremity, lower extremity as well. And so in any given session of data capture, we're getting in all of it. Whether you're doing an assessment on use of a boot that's supposed to be more ergonomically designed, or whether you're trying to understand when guys are standing on top of a carrier and they're loading material into a tanker via a hose, we can do that same analysis, or those two different analyses with the same approach from the wearable tech standpoint. And that's important for two particular reasons, right? When we set out to design and deliver this tool, we wanted to, one, simplify ergonomic evaluation. And we achieve that with this approach, meaning that whether you're measuring a very complex job or a pretty simple job, the approach is exactly the same, and it's super simple. Meaning if you can operate a smartphone, you can become an ergonomist in regards to doing this type of data capture. And then two, we had to bend the cost curve. Right, we just don't have enough ergonomic professionals in the U.S., let alone globally, to address the burden of overexertion in the industries, various industries. And so, providing a tool that these professionals can then deploy and then scale, leveraging technology, was very important and deliberate in regards to how we approach this tool and solving the problem in the workplace. So the variability in how we do the data capture mainly exists in terms of what outcome you're looking for, whether it's the ergonomic intervention or whether it's the productivity intervention. And that's basically the two modalities of data capture. The productivity capture requires you just to catalog your jobs, tasks, and subtasks, whereas the first piece of it, the ergonomic surveillance, requires only the first two layers, the jobs and the tasks.
Do you have conversations often, maybe with people who are employers, basically, about the upfront cost versus the benefits on the backside of having more productive employees and that sort of thing? So there's obviously a cost associated up front, and they have to then think through, okay, how can I best rotate employees and that sort of thing. So there's time and there's cost up front, but then on the back end, avoiding injuries, like we talked about at the beginning, that are costly, and then having more productive employees down the road. Do you have a conversation with employers about that, just about understanding the cost up front versus the benefits down the road?
We do, and actually over the last 3 to 4 years we've been doing this, the conversations have changed. Right, we started out having the conversation around keeping workers safe and prevention, and the ROI, return on investment, of preventative interventions, and particularly with ergonomics and overexertion injuries. And we get down to the numbers pretty often. And I mentioned the average back injury in the U.S. can cost about $80,000. and right away you can see the ROI from this service by preventing even just one back injury, let alone the multitude of injuries from carpal tunnel to epicondylitis, tennis elbow, to the others I mentioned previously. But over the last several years, what we've noticed is the conversation is shifting from one of us having to evangelize the benefits and the return on investment of these preventative interventions to one of, okay, what are the next steps is kind of the question we get from employers. How are we going to communicate this type of data capture and what we're doing to the unions and explain the benefit to them? So it's no longer a sense of we don't understand as employers the benefits and the return on investment. It's more of what are the best practices for deploying these type of solutions in the workplace so that we can reap the ROI of these interventions.
Interesting. Do you ever have employees push back on having their data captured or anything like that? Is that ever a conversation that comes up in this realm?
The conversation does come up, but it usually comes up not from the employees directly, but from the EHS managers, the health and safety professionals, as a precaution, all right? And certainly we've talked to risk management and the whole HR, and these are conversations that we want to have up front. Because we know that they're going to at some point bubble up, and we want to be a unified front in how we answer them. And there are clear best practices that we deploy. And actually, I gave a talk in New Orleans about 2 weeks ago on a panel talking about just this: what are the best practices for deploying wearable technology and IoT type solutions in the workplace? And one of the important ones is just around what we're talking about now. That you as an employer and certainly as a vendor engage in conversations with employees around what are the benefits and why we're going to use this data and how the data is going to be captured and secured, and as well as the outcome, right? So having unclear goals communicated or not communicated to employees leads them to kind of make up their own determination of this is good or bad, right? But we found that when we come to the conversation leading in with this is how we're going to use the data and this is not how we're going to use the data, then the conversation typically goes quite well. And we just won the support of a couple of unions, large unions, 50,000 workers plus, because we were able to address their concerns from a data capture standpoint. Now, certainly, when we talk about the type of data we're capturing, it doesn't cross the litmus test of PHI, personal health information, and we were deliberate in not capturing that type of information upfront. We are not a clinic, right? I am a doctor, but we don't run a clinic when we talk about doing this type of data capture. We're providing objective data around exertion, and it's much like you would do a sampling in the workplace for, let's say, noise exposure, right? Oftentimes, workers will have a little microphone that they don throughout their workday, and a safety professional is measuring what levels of sound pressures are being captured through the different activities that worker is performing. And so we're much the same, where we're, instead of capturing the noise, we're actually capturing muscle exertion, and certainly that data can then be de-identified if that's the wishes of the employer, just to give an additional layer to the anonymity of this type of approach.
Absolutely. Well, Dr. Anthony Harris, although for a second there I thought you switched to Reverend Anthony Harris.
I am a preacher's kid, so.
There you go. So you know it well. Hey, thank you so much for joining me here on the podcast and explaining a little bit more about where we are right now with wearable technology and where we could be in the future with preventing and managing injuries sustained in the workplace. Thank you so much, and I look forward to talking again soon.
Same here. Thanks so much, Tyler, and it's been a pleasure.